7:05, and we will get started tonight. First off, welcome to all of you. Have another good crowd here tonight. As always, make sure that you have either signed up on the EMS portal or you put your name and your EMT number in the chat box so I can make sure you get on there and you get credit for this. As you've heard me talk before, our ALS friends, we are having a lot of trouble with getting these things approved. I don't have anything yet for you. The Board of Osteopathic folks are having a lot of trouble with us doing this virtually. And I think that there's maybe somebody new there who's approving ours. So it's a work in progress. I think we're going to get there eventually. So we still really like having our ALS friends on, and we'll get you those hours when I can get them for you. Like I said, we're having some issues and we're working through them, but hopefully in the near future we can do that. A couple of announcements before I turn over to Keith is just a reminder. With the holidays and everything, it's kind of why we're on the first Thursday of the month. We are going to go back to the last Thursday of the month starting in January. So the next time that we will meet will be January 27th of 2022. So we'll have about almost 2 full months that we won't meet, with the holidays and everything there. So just so you guys are aware, and I think Michaela's going to send out some follow-up emails so you guys know when the next session is going to be. And also a reminder for those of you who are interested in it is the District 4 20-hour refresher will be February 18th, 19th, and 20th in Aberdeen at Presentation College. We will be working in the sim lab through some of our stuff. We will have a multitude of presenters like we have in the past, hoping to get some national presenters as well, getting Andrea back and those folks, and maybe talk Keith into doing something for us too if he's not busy that weekend. But that's kind of where we're at with that. So make sure you mark your calendars for that. There will be a virtual option as well. And we will get more info out to you as it comes available to us. So as we usually do, if you have questions throughout Keith's presentation, you can go ahead and put them in the chat box, or you can wait until the end and ask them. However it works for you, and however it works for Keith's presentation. But so without further ado, I'm going to turn it over to Keith Sharisky, who is the training section chief at Aberdeen Fire and Rescue, and one of my mentors, obviously, throughout my career as well. So we're very happy to have Keith on, and he's has a great presentation for us. So talk to y'all a little bit later.
Kyle, just making sure you can see my slides.
Yep, I can see your slides, you bet.
Perfect. Hi all, I'm Keith. I'm with Aberdeen Fire Rescue. Let's go to work. This is what I'm going to talk about tonight, and there's some things that I am going to target that we're going to talk about. So let's go to work. Let's watch a video maybe.
Firefighter take a dramatic rescue at a house fire in Highland Township. Oh, there you go, perfect. In the basement. It happened this morning on Northwood Road. They say 4 people and several pets were inside the burning home. It took 3 fire departments to put out the flame.
We don't have sound with it.
You might need to reshare your screen and click the little box on the bottom that says share audio.
Reshare my screen.
Yes. So if you go down to the bottom of your screen towards the middle, there should be like a green share screen button.
I got one that says I'm sharing screen.
Okay. Then you might need to stop sharing and then reshare, and then click there's a little button you'll need to click that says share sound.
Okay. I think I stopped sharing.
Yep.
Yep.
Okay. How about now?
No, we don't see your screen.
But you hear the sound?
Can hear
Nope.
it faintly.
Or we can hear it faintly, like it's coming from your.
Huh.
But if you click that share screen button, there should be on the bottom, like of the pop-up that comes up. On the bottom left, it says share sound. So you'll want to click that.
How can you see my screen now?
Yep, we can see your screen.
Okay. I can't find the share the audio button,
Okay.
so I'm gonna turn up my volume. See
Okay.
if that works.
Sounds good.
Rescue at a house fire in Highland Township, saving a 41-year-old woman who was trapped in the basement. It happened this morning on North Milford Road. Police say 4 people and several pets were inside the burning home. It took 3 fire departments to put out the flames. All 4 adults were taken to the hospital for smoke inhalation. The home was a total loss. Now, police suspect one of the pets likely knocked over a heater in the garage, causing the fire.
So that's what we're going to talk about, is smoke inhalation and stuff like that. And give me just a second. You guys see that screen?
Yes. Yep.
Give me a thumbs up, Miss Michaela or Kale. Excuse me, Kyle. Thank you. So let's go to work, maybe. So these are objectives. I got in here because obviously, or not obviously, but obvious to me, I have to write objectives that are measurable and all this other good stuff. So these are the objectives. The short story is we're going to talk about products of combustion and what they do to you and how you're going to treat them. A lot of people are confused, and I'm emphasizing confused, and I don't know why, but are confused about the products of combustion. So let's take a look at some numbers. You're going to see at the end of my presentation my citation sources, but I try to put the citation sources in so that at any time you can look them up and say, Keith, that material's outdated and things like that. But this information comes from the United States Fire Administration. And these numbers are 2017 to 2019. The most recent numbers are still being compiled and things like that. But what's cool here, or not so cool, is from structure fires, there's 7,200 civilian injuries for this. That works out that at least 1 person is injured every 45 minutes. So the peak period here is 5 to 8. And then I put a question in there, why do you think? And since we're kind of not opening this up for discussion yet, I'll kind of answer those questions. The reason being for that is, frankly, that's when we're cooking. And sometimes cooking fires get away from us. And when cooking fires get away from us, then the house fires get away from us, and then we go from there. And then the next bullet point, if you will, that I have here, peak months, January through March. This is more important to the northern hemisphere of us. And the reason being is because we're inside, it's cold out. Now that does not remove Arizona, Louisiana, and things like that, because they get a little chilly down there as well. But this is more towards the northern hemisphere when we start looking at this. So of those 7,200 civilian injuries, you're looking at 54% of those being guys. Guys, boys, males, old guys, well, however you want to look at it, it's the males that are getting hurt. So the United States Fire Administration listed human factors. And so I cut and pasted from that human factors. And during this, of those injuries, 49% of those people are victims or patients, whichever terminology you would like to use. 49% of them were sound asleep, and they got injured, hurt, burned, smoke inhalation, and all that other good stuff. Now, for those of you like me who like to binge drink every now and then, 16% of us got hurt during that time. Now, we all are normal. And when I say, I can't use that terminology because I just alienated people. What I want to look at here is the impaired by other. That's, you're looking at illegal and legal medications and drugs when it comes to that. We cannot in any way, shape, or form forget our physical disability people. There's a couple fires that I've been on here in Aberdeen that they probably could have survived if they were not disabled, or their house, if you will, was set up for their disability. So that's kind of a sad fact, but it is something that you guys as firefighters, EMTs, law enforcement, paramedics, nurses, I do apologize, there's an ambulance call going on right now, and I don't have control over the radio traffic. So now let's move down to the injuries. We have all kinds of injuries, but the primary injuries are smoke inhalation. There are thermal burns, or let me rephrase that, smoke inhalation and thermal burns account for 79, almost 80% of the injuries. And something that's really cool, you know, you figure 7,200 people were injured in fires, and 54% of those were males. And of those males, 44% of them were between 20 and 49. Now think about this. The other, or not the other, but 50 years old and above were 41%. So being a male, being in a fire, you're kind of condemned to being hurt. Now, where are you normally getting hurt at when you're in a fire? The primary location, according to the United States Fire Administration, is 33%. Now, for our firefighters that are out there, you will, or have had, or have been told that when you get to a house fire, and if you can at least get to the front door and open the front door, some of our victims are 5, maybe 10 feet in. And so you've had risk versus gain, and I apologize, guys. For my job, I have to check things out, and I had a text come in. For you guys who've been learning about risk versus gain, or have had risk versus gain, you will reach in and grab those guys, but understand they are injured. So now, guys, this next video is kind of long. It's actually 15 minutes long. There will be times where I'm going to kind of speed through it and things like that. But one of the things I want you to look at is fire progression. And this is in a bar, but it shows really good fire progression. Also, it shows what people are like when there's a fire. And you guys as first responders, when you walk, arrive, get there, you're going to be wondering why people are, well, let's go crazy at that. So let's watch this for a little bit. Oh, good Lord. Would you believe YouTube has said this video is unavailable? Check with my administrator. So give me just a second to do something goofy. Oh my Lord. So what's really crazy is when I tested this earlier this morning and then earlier this afternoon and went through this just a little bit with Michaela, everything kind of worked, but right now it's choosing not to. So in this video that I was going to show you, but does not seem to want to work right now, I'll just tell you a little bit about it and try to paint a picture. It's a video in a small community that has a volunteer firefighter, volunteer fire department. It is a bar that's on fire, and the back of the bar is on fire. So imagine a good working fire, it's right there. In that good working fire, you have an awful lot of fire, an awful lot of smoke. The smoke is primarily black with a little bit of white coming out of it. And it's relatively important that we understand that, because eventually we're going to talk about what's in that smoke. Another thing that you'll see when you're doing this is people
to call this guy out or make fun of him. This again shows what TV and movies don't, how they're different from reality. This is not a backdraft. This is not what a backdraft looks like. Varying levels of intoxication. The original video in the description down below if you want to see that. But apparently whoever this person was going back in there to get their cell phone. Do not do that, obviously for your own safety, but also for the consideration of the firefighters, because when the fire department shows up on this, there's a lot of things going on this scene. You have a bar that's obviously on fire and you saw a whole bunch of people walking around. It's going to be difficult for firefighters to determine it. You're not only putting yourself at risk, but you're potentially putting firefighters who are going to at least attempt, probably, depending on the situation, to try and go in and save your life. You're putting somebody else's life at risk now because of your cell phone. Again, it seems fairly obvious, but do not do that.
Oh my God, that sucked so bad. I was like, is that the first board on fire? I thought from Alpha 229. I said, dude, you guys keep look. The first one's gonna be burned out. You went after you do that phone. It's brick, but I mean, that's coming. Look out, backdraft. Well, yeah. Backdraft.
So next thing I want to point out, you can hear the guy in the back saying it's back half of this building, the patio bars. But no, this is not a backdraft.
Oh my God, is he still inside? Yeah. Is he inside or not? Get out of there! Amanda! Oh my God, why does sister go inside? Amanda, get out!
Next thing I want to point out, you see how
So goes on and he breaks down more of the video and shows more of what people are doing and what not doing. The reason why I like showing that is you saw all the smoke, you saw the fire. If we were to watch the video all the way to its conclusion, that wood portion of the bar would be burnt clear up to the cement and or brick portion of the building to my left. Hopefully it's your guys' left as well. Another thing I'd like you guys to notice is you saw people running in and running out. This is something that you're going to see or have on your fire scenes. And when you show up in your ambulances, you're going to be asking, okay, who's hurt, who's not hurt, all this other good stuff. And then when you find out that Tom, Dick, and Harry are hurt, you're going to wonder what is hurt on them. So right now you should be looking at a picture of the upper airway and just a little bit of anatomy here. In the upper airway, you got the tongue, which is quite muscular. You got the nose, which has the turbinates and all the cilia in there. And you can see as it's going down into the trachea and all that other good stuff. Now imagine this, you got a bunch of superheated air going in there, and the turbinates up in the nose and the back of the oral pharynx or the back of the mouth. The job there is to heat up the air and humidify it. Well, our patients just took in dehumidified air that's superheated. And so you burnt all the hair, so the hairs cannot catch all the soot that's being produced. So everything that they can't catch is now going into the lungs. The superheated air is now making the airway starting to swell up, cook, because that's its job. And now let's take a look at this. That superheated air and that soot is now down into your lungs. And we know that our lungs, we go down to the trachea, we go to the right and left mainstem, and we start breaking off into the bronchioles. And then we eventually get to the alveoli. And at the alveoli, they're basically one cell thick, and it allows oxygen to pass to the blood and carbon dioxide to pass across to the, let's call it the outside air, so it can be transported to the outside air, I'm sorry. So now you got superheated air in there, and you guys all fry eggs every now and then. What happens when you fry an egg? Well, it denatures. That's the technical term for it anyways. So that superheated air just denatured your lungs or your patient's lungs. And you as EMTs are going to have to try to take care of it. So we just talked about thermal burn in our airway and on our lungs. And like I promised you, I want to talk to you a little bit about some gases and some other things. So when you get there, these are some expectations. You need to expect that there will be lung damage. There will be inflammation. That inflammation can happen acutely, depending upon how much and how deep of breath they took when they got burned or were in the fire, or it can take up to days. Now, when we say it can take up to days, the injury is still going on, and the alveoli are no different than any other cells in your body. As they get injured, they try to heal. When they try to heal, they bring in moisture, they bring in water, they bring in the nutrients that they need to start healing, just like when you cut your finger or something like that. When you deliver them to the hospital, the doctor is going to want a chest x-ray, and he's going to show you the lungs are clear and everybody's warm and fuzzy. You're going to have your pulse oximetry on them. You're going to see that they're going to have a near normal appearing pulse oximetry, oxygen saturation, probably right around that 98 to 100%. And right now, everybody's warm and fuzzy. That's an ambulance call, guys.
Attention medics, currently staging the area 706, 8,000 Northeast for a domestic assault. Right now, we don't know of any injuries, but they do see blood on walls. 706, 8,000 Northeast is staged.
Hopefully none of you guys live there, and now you know the cops are coming to get you and the ambulances are coming to get you. So I hope somebody's giggling over it, but I just said. So anyways, these are some of the expectations that you as first responders can expect. So what's in the smoke? Well, you've all been told it's particulates, and particulates make yeah, I can't add to it, I can't take from it. But what are the particulates? Well, they're very fine solids, and they are incomplete products of combustion. Now, I put up here in a bullet here that it's the most visible parts of combustion, and that is a true statement. Also, what's in the smoke are gases and vapors. And when we start talking about gases and vapors, I guess I would like us to think of all three of them being together. For me, it'll make it easier to explain things. So we all know fire produces carbon monoxide. It comes from incomplete combustion, and at every fire, doesn't matter if it's a structure fire, car fire, wildland fire, anything like that, super large amounts are there. What do? Well, they get on our oxygen, and we've learned through our classes that it creates carboxyhemoglobin. Well, what does that do? Well, it basically keeps the oxygen from reaching the cells of our body. Because of that, it pretty well much starves the body from oxygen. Now, here's where, here in a little bit, I'm going to kind of contradict some treatments and things like that. And the reason why it's going to be contradiction is because I took information from NIOSH, United States Fire Administration, the Canadian Building Digest, and PHTLS. So you will need to wrap your head around what you think is the most appropriate. So one of the more misconceptions are that as soon as we take them outside and they start breathing regular air, life is good. For the most part, yes, life is good. And I have a bullet here that says 50% will be eliminated in the first hour under ordinary fresh air. You're going to see some different numbers here in the next 4 or 5 slides that are going to contradict this. So now NIOSH says that 50 parts per million we can tolerate, the human body can tolerate. NIOSH also says that at 1,200 parts per million, it's immediate dangerous to life and health. Now, keep this in mind. That doesn't mean it's going to kill you right then and there. What that means is that if you stay in there really too long, you're going to die. Now, the Canadian Building Digest published that at 4,000 parts per million or higher, it's fatal. Now, keep in mind that video you were just looking at with the bar that was on fire. There are more. There is more. There are more. There is more than 4,000 parts per million of carbon monoxide in there. And we had potential victims running in and out for who knows what reasons, and they are being exposed to that. So you guys as first responders, EMTs, are going to have to take care of that. Did you guys know there's carbon dioxide in smoke? With carbon dioxide in smoke, I was unable, I apologize, to find out what causes the carbon dioxide in the smoke, but it is there. It does stimulate respirations. So when you think about this, carbon dioxide stimulating respirations, not only are you already taking carbon monoxide in, now you're getting stimulated to breathe even more. So now you're taking in more carbon monoxide. I put some numbers up here. 5% equals 50,000 parts per million. And when you're at 5% and you're breathing carbon dioxide, you get drunk. You act drunk, you look drunk, you are drunk. And so we as first responders are we looking at a drunk patient, or are we looking at a smoke inhalation injury patient? So something to think about. I also got some other numbers up here, and this is where you see some contradictory in things. You're looking at 7% unconsciousness in a few minutes, and that's from the Canadian Builders Digest. Whereas NIOSH has 4%, we're starting to get into that dangerous area. So the short story is that a little bit of carbon dioxide is going to make your day really, really bad. Now, we've all heard there's hydrogen cyanide in the products of combustion. So where does this hydrogen cyanide come from? I put some examples up here. You got nylon, wool, polyurethane, ABS. Those all have, well, I forgot the chemical I was looking for. But when they catch fire and they break down, whether it's complete or incomplete combustion, they produce hydrogen cyanide. So that hydrogen cyanide's floating around in with all those particulates, all that other gas and vapor, and our victim is breathing that in. What does hydrogen cyanide do? Well, the short story is on the third bullet here, it says prevents the transfer of oxygen to the cells. Basically, because the cells can't get oxygen, the body asphyxiates. That's a really horrible way to die. So both the Canadian Builders Digest and NIOSH have a threshold limit of 10 parts per million. So guys, think about this, 10 parts per million is next to nothing. So according to CBD, symptoms begin at 20 to 40 parts per million. Guys, that's not even a nanosecond, if you will, of you taking a breath right now. NIOSH has the IDLH at 50 parts per million, and CBD has you dead at 3,000 parts per million. Now, if we wanted to do the math and look at this in percentages, 3,000 parts per million is 0.00003 percentages. That should scare us just a little bit about how dangerous products of combustion are. Smoke. It also should scare us into making sure that we jump on top of our patients and start their treatment relatively aggressive. Radio traffic, giving it a second.
Medic 3 will be staging in the area of Dakota and 8th Avenue Northeast.
So in our houses, we have PVC. When PVC catches fire and starts burning, it produces hydrogen chloride. Now that's not a really bad thing because you can use hydrogen chloride for all kinds of things. The problem is when it attaches to the water that's inside your airway in your lungs, it turns into hydrochloric acid. That hydrochloric acid is relatively bad for the human body. Now also understand, for the firefighters that are out there, you've had instructors tell you that every fire has phosgene in it and things like that. That is a true statement. But when we start looking at the amount of phosgene that is in fires, it's really quite negligible. Your primary chemicals that we're talking about are the ones that we have to worry about. Now, look at the numbers down here. I'm going to go back just one slide. So we're looking at 3,000 parts per million fatal for hydrogen cyanide. At hydrogen chloride, we're looking at 1,000 to 2,000 parts per million is lethal. So my question is, or something for you guys to think about is, hydrogen cyanide has a really bad rap for killing people, but what about hydrogen chloride? It'll kill you just as fast and just as dead as hydrogen cyanide. So nitrogen dioxide, this is a kind of a cool thing that's in there. So your cellulose products, this includes your solid I swear guys, I'm not drunk, I'm just having a hard time talking. Solid plastics, adhesives, and you see here explosives, film bases, and things like that. For our residential structure fires, we're targeting solid plastics and the adhesives. The adhesives like that hold your carpet down and things like that is what I'm talking about. When these catch fire, they release that nitrogen dioxide. And nitrogen dioxide turns into two things: nitrous oxide, which makes us happy, and nitric acid when it gets into the parts of our airway that have moisture. The nitrous oxide will kind of float away, but the nitric acid will start doing its job, which is to burn and cook things. Now, if you remember on the previous two slides, Hydrogen cyanide was fatal at 3,000 parts per million. Hydrogen chloride was fatal at 1,000 to 2,000 parts per million. Look at this, that bottom bullet. Nitrogen dioxide is fatal at 240 to 775 parts per million. If these numbers don't scare you into making sure your smoke detectors are running and you have good, clean avenues of escape, then I don't know where I'm going with that, so I apologize. But what this should tell you guys is, quite frankly, this: smoke inhalation is dangerous. And you guys, when I say you guys, all of us have to be on top of our game when we go take care of our victims. So index of suspicion. This is where we have to look at stuff. If your patients were pulled out of a confined space, if they are acting like they're drunk, if you see burns to their face or singed hair to their face, if they're coughing or spitting up soot, they have inhaled smoke. And we just learned what is in that smoke. So we should be prepared to go to work for these guys. Now remember, at the beginning of our discussion, we talked about sometimes it will take a while for symptoms to be seen or show themselves. So do not lose your index. Do not write it off. So treatment. I told you also at the beginning of our discussion that we would have some contradictory stuff. So here's some contradictory stuff. According to Canadian Builders Digest,
This is Medic 3.
Medic 3, officers advised you can stand down.
10-4, Medic 3 will be clear and available.
so according to the Canadian Builders Digest,
10-4.
once somebody's removed to fresh air, they can have about 50% of their carbon monoxide eliminated in 1 hour. According to PHTLS, that takes 4 hours. What I'm getting from that information, quite frankly, is get them out into the fresh air. Now, you get them out into the fresh air, they're starting to have a hard time breathing, or you see some of those signs like soot around their mouth, a little bit of confusion. Now's a good time to get a non-rebreather mask on them, set it at flush so that they're getting 100%. With that in place, PHTLS tells us that that will take about 40 to 60 minutes to get it down to 50%. One thing I would ask you guys to think about is 50% of what? And the key word here is what? Do they have 100 parts per carbon monoxide on their blood, or do they have 8,000 parts of carbon monoxide on their blood? So just because you have them for a half hour with 100% oxygen, they're not out of the woods yet. So hyperbaric chamber, there's always questions about hyperbarics and their use and non-uses and things like that. When I was looking at PHTLS the other day, it caught me off guard that PHTLS noted that hyperbaric chamber treatment is controversial. When I look it up on the internet, every hyperbaric chamber there is wants to treat carbon monoxide poisoning with 100% oxygen under pressure. So where I'm going with this is that you're going to have to treat your patients with 100% oxygen, rely on your doctors to make the calls to the burn centers, and or for you guys to be patient care advocates and ask your doctors to make the calls to the burn centers. Bottom bullet there, I have BLS, advanced airway adjuncts. You need to use these as needed. If our patient is unconscious with no gag, get the OPA in, get the eye gel in, start bagging with 100% oxygen and things like that. For our ALS providers out there, get the ET in. You need to get the ET in because that airway, remember, was just cooked with superheated air, and that's going to start swelling up. So don't mess around, get that airway in. Hydrogen cyanide. So a war story, if you will. About 15 years ago, I took a class at the Fire Academy for ALS Tox Medic. And what I learned there for hydrogen cyanide, that they get a cyanide kit. Now, first bullet here says Cyano Kit. That's different from what I just told you. What I just told you was it's known now as a Lilly or Pasadena kit. So if you look at that bottom bullet, basically what they're doing, or what that kit does, is take that hydrogen cyanide, convert it to met hemoglobin or methemoglobin, and so that the body can excrete it out through its urine. But look at the last sentence. I'll try, or not the last sentence, the second to the last sentence. This poison is then excreted through the patient's urine over time. Now I'm highlighting this poison because methemoglobin is a poison. So the Lilly and Pasadena kits that I was taught on to treat hydrogen cyanide with, actually I was converting one poison to another poison so that second poison can be excreted out by urine. And that explains why after we gave that kit, we had to treat the signs and symptoms to keep them alive long enough to excrete that. The Cyano Kit, that very top one that's there, most, or I can't say most of your hospitals, but hopefully your hospital has one of those. And what that does simply is it blocks the hydrogen cyanide and allows the cells to start breathing again. So that's kind of cool historical information, I thought. So these are the gases that we just talked about. And we talked about basically managing your airway, and that's truly all we're going to do. And so that bottom bullet, when you look at the treatments in PHTLS and NIOSH, basically say respiratory support, get advanced immediate care to them. And when they're talking advanced immediate care for our rural areas, when you're transporting to your local hospital, get air ambulance coming. If you have the ability to call for ALS intercepts, get them coming. Don't wait. These patients need pretty aggressive treatment, if you will. So if anybody's got a weak stomach or eating some food right now, it probably ought to warn you. I got a couple pictures up here that are going to may turn your stomach. So there's your warning: TVMA, PG 14 and above, and all that good stuff. So first degree, basically it's just messing with the top layers of your skin. It's a sunburn. You're looking at a sunburn right here, really quite painful. This will take about a week or so to heal or start getting away from the pain. We all have had sunburns. Sometimes they take 2 weeks and things like that. That's just our body doing what it needs to do to heal. So partial thickness, also known as second degree. I like this picture because you can see the shiny skin that's going on there. That's an indicator of second degree or partial thickness. The new terminology, I should be clear here, the new terminology is partial thickness. For us old timers out there, we learned it as second degree. Now, the reason why I like this picture also is because of the circumferential burns that you see here. You could be taking care of a patient that is developing compartment syndrome because of these burns. hopefully you've had a lecture or two about escharotomies and things like that. As much as I'd like to do one, I'm not trained to do it, so I can't do it. But if they don't get that pressure released a little bit, they're going to cause more damage to the underlying structures. Now, eventually we're going to talk about some fluids, so try to keep this picture in the back of your head. So full thickness is the new terminology. We known it, or the old guys, at 3rd degree. You're seeing some charring. You're seeing that it's going all the way through. I'm straightforward. It's going all the way through the meat. And there was a time, about 20 years ago, where 3rd degree came out, and then they said it was a deep 3rd degree and things like this. This is a classic 3rd degree. This is charring to the meat. This is really quite damaging to the patient. Now, on a side note, you see that this is in the right hand. It's an extremity and things like this. This young person automatically qualifies for a burn center for several reasons. One, it's in an extremity, and 2, because of the 3rd degree. You can see on the edges, if you will, the outline edges, you see some blistering and things like that. That's your 2nd degree. You go a little further out and you'll see some redness. That's your 1st degree. I'm going to use the word misconception, but I don't think that's what I mean. But the misconception is that burns don't hurt when they are like this. Well, the burns that are surrounding the deep tissue burns are really quite painful. And we'll talk a little bit about analgesia here in a little bit. The reason why I mentioned the pain is we don't want it to mislead us or take us away from the treatment of the patient. So now, 20 years ago, there really wasn't a 4th degree. It was a full thickness or deep 3rd degree and things like that. Over the past, I'm going to say a few years, because I don't know exactly how long, they've classified subdermal, and it's now considered 4th degree, or we knew it as 4th degree, I guess, if you could see. Now, you're looking at a leg, and what's really kind of hard to imagine is that it is burned clear to the bone. You see muscle burned. You see everything is just literally, without trying to be facetious, it looks like a roast that you would have on your grill. So my computer popped something up. I had to look at it, so I lost my train of thought. In this particular case, I don't even know what to tell you. I lost my train of thought, so I'm going to the next slide. I do apologize. So treatments. We always, mom always told us to put butter on it, put ice on it, all this other good stuff. Let's take it to let's break it down to its simplest form. Stop the burn. Get the burned clothes off unless they are seared to the skin.
Medic 1 has arrived out of there. That's fine.
I was waiting for the 10-4. So we don't put butter, we don't put antibiotic ointments, we don't do any of that stuff. We stop the burn, and then we protect the burn from infection as best as we can. The simplest way of doing that really is a sterile sheet. Now, a lot of people will tell you that as first responders, we want to do something a little bit more. We need to be more aggressive. We want to do more. Well, guys, and gals, that is quite frankly the best treatment there is a sterile sheet. Now, I did put a bullet up here that says wilderness and military. they have access to a sterile sheet that is impregnated with silver. Silver is a natural antimicrobial agent. And so when they put that sheet on them, not only are they attempting to prevent infections, that silver is also going to work at the microbes that are on the body and trying to kill them as best as they can. This is not an ointment. Now, some of you all have been to hospitals where they've had silver, it's an ointment, but I can't remember exactly what it's called. And the doctors and nurses will put it on those pains, or excuse me, those burns. It's the same exact concept, except it's not in a lotion or a liquid form, if you will. Fluids. ALS guys, you got to get fluids going for them. You got to get the IV, you got to get the IO, you got to do what you got to do to get fluids in there. When the burn happens to your patient, the body's response is to send a lot of fluid to the affected area that causes swelling, that causes cooling, that causes hypotension, and those cells are already leaking that fluid because they're injured. So you got to get fluid to them, and we'll talk a little bit about the Parkland Formula. The Parkland Formula is kind of cool, but this is not going to be something I'm going to expect you to memorize tonight. ALS guys, treat for pain. It is really kind of cruel on our part to not treat for pain. I got fentanyl and morphine up here. Those are the two primary pain control medications, if you will. Aberdeen Fire likes fentanyl. It's quicker acting and it's shorter acting. So that means we can get it on board, control the pain, and then we can follow it up with morphine. The drug dose that you see here, it comes from the PHTLS book, but you guys have to follow your local protocols when it comes to that. Treat for shock. These guys lost their ability to keep themselves warm. So you have to keep them warm. You're probably thinking they just got burned, they're warm enough and all that good stuff. And on the periphery of their major burns, they're going to be in pain and they're not going to want you to keep them warm. But their body has lost the ability to do that for them. So you have to keep them warm. You do not want them to get cold while you're treating them for shock. So you're looking at the rule of nines and things like that. I'm not going to spend a lot of time talking about this because hopefully you got this in your EMT course and paramedic course. So what is burn? This is nice to know information. The reason why I say it's nice to know information is because for the ALS guys and the in-facility guys, they're trying to figure out how much fluid to give. And they're going to have to give a lot of fluid. The short story is for the ALS guys, get the fluid going. Let the doctors and nurses figure out the percentages and the actual Parkland formula. Now, with that being said, if you're in one of our more rural areas, then you're going to have to figure out about how much fluid you want to get going. So let's talk about this. This is the Parkland formula. This is the traditional Parkland formula. You're looking at 4 mils per kilo per percentage burned. So there's your percentages. You're looking at 9s and 18s and 1% and all this other good stuff. So you're going to try to figure out what the percentage is. Then you're going to times that by 4 mil, and you're going to times that by their body weight. That's going to tell you how much fluid to give them in 24 hours. But half of that fluid has to be given within the first 8 hours, which short story means is you're running a lot of fluid. The military, the Army, and those guys, they came up with the 4 times 10 rule. And I thought for a second I was going to try to explain that, but I lost my notes, so I apologize. Please forgive me. Okay, just because you're in a fire does not mean you don't break something, you don't bleed something, anything like that. Short story is stop the bleed. Do what you have to do to stop the bleed. Every red blood cell counts, and the red blood cells that they have are really quite at a disadvantage, because you remember all the products of combustion. You got carbon monoxide, you got carbon dioxide, hydrogen cyanide, nitrogen dioxide, hydrogen chloride. All that's floating around inside the body as well. So we need every red blood cell that we can. For the brakes, it's always nice to try to splint the brake in the position found or in the proper anatomical position. Keep in mind, if that area is burned, you're not going to use tape. You're going to try to use some sort of sterile. It would be nice for me to tell you to use sterile cling, sterile dressing to do it, but you're going to have to do what you have to do to get them to the hospital. So this is the last video. We're going to watch this video in its entirety because I want to end on a really nice note here. Give me just a second.
Zoni's our little girl that was at Nationwide Children's Hospital for 35 days.
My family started vacationing in northwestern Michigan in 1988. It's been a family tradition every summer since then. We made plans to go up there for a week.
The family spent their first day on the beach.
We got back to the house and the boys went off to do what the boys were doing. And I took the girls.
All of us, we helped pitch in, put the logs in, and we had the fire going really well.
We're not sure really what happened. Our 7-year-old told us that she ran past him playing tag or something and looked at him over her shoulder and then stumbled and fell right into the fire. What happened next is something I wish I'd never seen before. I heard him screaming and then I saw she could see what had happened and I couldn't because
And she was just sitting on her bottom with her hands back trying to hold her, and she was just covered in flame.
her pants and her shirt were on fire back.
It ate away her clothes.
I just put the flames out on her clothing.
And then I held her while he called 911.
Zoni was stabilized in Michigan. After a couple days, she was taken to Nationwide Children's Hospital.
It wasn't until we got to Columbus that they decided that it was 20% full thickness, and then there was some additional first and second degree burns on her arm and her back.
Her back, her upper and lower extremities were quite deep, as you can imagine, from being exposed to the fire.
Zoni's condition was bad, so doctors decided to put her in an induced coma for 6 days.
It was hard on us to see her in that condition, and I think she was there in an ICU for about 18 days.
During the course of that time, music therapists played and sang Zoni's favorite songs.
We could tell that she liked it because even though she wasn't that responsive, her eyes would twitch on her favorite songs, or she kind of ran a little bit.
Zoni had one debridement procedure to clear away the dead skin. After that, she underwent skin graft surgeries. Soon after, Zoni was returning to her old self. Throughout Zoni's 35 days at Nationwide Children's, child life specialists distracted her with toys, games, books, music, and art.
very scared and emotional.
It takes a big team to take care of patients with burn, including psychology and social workers, recreational therapists, massage therapists, musical therapists, and so forth.
The Christine Wilson Burn Center at Nationwide Children's treats infants through young adults whose burns cover anywhere from 1 to 85% of their bodies. We use the newest technologies and treatments, from our advanced operating rooms, spacious procedure rooms right on the unit floor, to unique distractions meant to ease the biggest worries of our littlest patients.
Burn injury is much more than just wound itself. It's not just a disease of the skin, it's a big impact of psychological problems.
Hospital saved your life.
Very good. And what about
At Zoni's follow-up appointment, she's checked by a team, including physicians and occupational and physical therapists. Depending on her progress over the next 9 to 20 months, Zoni will wear compression garments on her legs and one of her arms.
We're just thankful that she survived.
You're doing great. She's back in school.
every child? We feel like it's one of our.
Guys, I wanted to share that video with you guys. It wasn't a structure fire victim, but it was a pediatric patient, and we did not talk about pediatrics. But I wanted to show you that, to let you know that with your care, our burn victims, our burn patients can survive with a little bit of luck, a little bit of good care on everybody's part. And I really don't know how else to add on to that. My discussion is over. These are my cited sources that you saw right there. And if Kyle or Michaela has any questions they need to pass on to me, please, I will be here for you.
I got one that popped in, Keith. It says, what can you use at home instead of sterile sheets?
I'm not hearing anybody, so I'm assuming,
Can you hear me, Keith?
Kyle, I see you talking, but I don't hear you, brother.
Keith, can you hear us?
Michaela, what's he got going on? I'll call him.
I think his speaker is because it's connected to him. Or his
So
sound.
if anybody's talking to me, I'm not hearing you. Michaela just gave me the finger, so I don't know if that's a good thing or not. Yes, sir. Oh. At home, a clean sheet. Short story. At home? Well, clean sheets, anything clean. Anything that keeps the air off the skin. It's the air on the skin that's causing the pain. So we got to try to stop that. Okay. I got my stuff closed.
Can you hear me now? Still not. Anyways, the question that came in is, what can you use at home instead of sterile sheets? And if you heard Keith's answer, was just clean sheets.
Oh, So there's a question here from Laura Kirkpatrick about, do we recommend any ointment at all? No, the doctors need the ointment off because when the patients get there, they have to do the assessment of the burn. And then with the assessment of the burn, that also goes into how are they going to treat it and get the skin debrided. I guess if you peel off the dead skin and stuff like that. So if you put ointment on there, you're delaying that treatment. And then the secondary thought is by having ointment on there, you may be keeping heat in depending upon when you put the ointment on. So no ointment.
Keith, any luck? Can you hear me yet?
So the question is pain management when alcohol's involved. If they're screaming in pain, they get pain management. Pain will override, if we can imagine that, pain will override the intoxication. Now, the hard part about that is when you start mixing, I'm going to use the word intoxicants. So the intoxicants would be fentanyl and alcohol. Then we really have to pay close attention to their respiratory drive. So with that in mind, I would ask you to defer to your medical control for that. I would be using fentanyl, and I would have, if they're not already intubated, I would be ready to intubate. I hope that helps, Lisa.
If you have any other questions with the technical difficulties, go ahead and put them in the chat box. Michaela, do you have a survey again at the end?
Nope, not today.
Okay, sounds good. Yeah, if you just want to drop Keith a line, tell him thanks a lot. I don't know why he can't hear us, but it's fine. So, Michaela, anything else? Tonight?
Nope, I'll be sending out an email that kind of gives a summary of what Kyle had mentioned prior to the webinar. So
Awesome. Well, again, if you have not registered online, make sure you let me know some way, shape, or form so you can get credit for this. And registering online, I mean registering in the portal. Some of you had sent me information and you were already registered, so we're all good there. If you need me to register, you go ahead and just send a chat in the box, and we'll go from there. Otherwise, I hope you all have a safe and Merry Christmas and a Happy New Year, and we'll see you all again January 27th. Good night, everybody.
Kyle, when I send over the participants, I can send over the registration where I believe I asked for their EMS number or their EMT number.
That's good. Yeah, and then just you're gonna send the chat over too if you can.
Yep.
Then I'll get those off there. I put most of them in already, but I see we got I'm gonna write these down quick before you end it.
Okay, sounds good.
It's Debbie Hansen, Marty Hansey, Levon. Okay, should be good.
Awesome. Cool.
Talk to you Monday.
Talk to you Monday.